Okay, now we enter in the categorization of the antibiotics. So the European authorities decide to put in different groups all the antibiotics depending on the restrictions that they want to put on it. Then these categories are divided in 4 categories. The first one is avoid. Avoid means that all the antibiotics of this category are not authorized as veterinary medicines in Europe, are authorized for human, for example. So these antibiotics cannot be used for food-producing animals, okay? And only can be used in very exceptional circumstances in companion animals. So from now on, we will not talk about this because we are talking about food-producing animals. Then for food-producing animals, we have these 3 categories. The first one, the category D, is the we call prudence, is the first line treatment. So it's the when you have a problem, the first antibiotics you should use is the antibiotics in this category. Okay. Later we'll see which ones are in these categories, and always should be used prudently, only when medically needed. The second category is the caution, this yellow category. The antibiotics here you have to use always when you don't have an alternative belonging to category D. So when you want to treat some indications that are not in the products in the category D, you can use this category C. And the third one, the category B, is the restrict. So it's the most restricted category. In this category are the medicines that are critically important in human medicine, and used in animals should be restricted to mitigate the risk to public health. So molecules that are used in human and in veterinary at the same time. It's not the case of these 2 that are not used or in human have other alternative for this. Then when we can use the category B. Category B should be used when you don't have an alternative in the categories C and D. When you don't have alternative here, you have to go to this. But in this case, also you have to use, should be based on antimicrobial susceptibility testing. So you have to make antibiogram. If you want to use this one, first you have to justify that you don't have alternative here or here, and a part of this, you have to make antibiogram to prove that you really need to use products of this category. Okay? Then, now we'll see which molecules are in each group. Okay? You can see that there's a lot of molecules, but I will explain you the more common molecules that we use. In the category D, prudence, this is the first line treatment. You have the sulfonamides, okay, sulfa plus trimethoprim. You have the tetracyclines, doxy, the oxytetra, tetracycline, and also you have the amoxy and penicillin, so the beta-lactams. Beta-lactams, sulfa, and tetracyclines. This is the first group and the less restricted group. In the second group, the group of caution, we have the aminoglycosides like gentamicin or neomycin, is the most famous. You have the first and second generation of cephalosporin. Also you have this beta-lactam with clavulanic acid, the amoxy with clavulanic clavulanic acid is in this group, not in this group, like the normal amoxicillin. And also you have the fluorphenicol and the macrolides, diamulin, the tylosine, the tulathromycin. This is the group caution. So actually, more or less, the products that are used the most are in these groups, in these two groups, because are not very restricted or are more or less easy to use. The group B is the most difficult to be applied for the veterinarians when they make the prescription, because, as I told you, first you need to check if you have an alternative here or here. If you don't have an alternative, you have to choose one of these, but first you need an antibiogram. Okay. In this group, you have the quinolones, enrofloxacin, marvofloxacin, the polymyxins, that is basically the colistin, and the third and fourth generation of cephalosporin. Okay, this is basically how we have to work in Europe for the prescriptions of antibiotics. Other factors to consider is the way to use it. So the European authorities are saying that we have to try to make individual treatments first, then group treatments. So following this idea, the route of administration should be taken into account. In this case, the most easy is to make local individual treatment. So individual treatment in local places like the udder injectors or eye or ear drops. The second is the individual injectable treatment. So injectable treatment for a specific animal. Then the oral individual treatment. So when you treat orally an animal, a specific animal, with the tablets or oral bolus. And then we start with the metaphylaxis. So injectable group medication or oral group medication via drinking water or milk. And the last is the via feed or premix. Okay, the treatment with premix is very, very restricted. Put antibiotics in feed in Europe nowadays is very, very restricted, and you need justification.